Dr. Tim O'Neill is here, and he is a doctor, medical practitioner, Majura Medical Centre here in Canberra, great friend of the Fatherhood Foundation, great friend of men here in Canberra, working with drug-addicted men and men who are working through many, many issues, and passionate for men's health. Dr. Tim O'Neill, thank you.
Thanks, Warwick. I feel like a small boy amongst a group of giants in this men's movement, many people who have spent a lot of hours, a lot of time, who definitely have nerves of steel and who are running a marathon and who aren't just sprinters. And I feel very privileged to head the discussion off. Over the last 50 years, we've done very well with health in Australia, that is apart from Indigenous health. The life expectancy for men is 79 years, a little bit behind the best in the world, and the life expectancy for women is 83.7 years, the highest, equal to the highest in the world. So why are men really worried about their health? Right at the start, I think we could say that the participants in this forum are from many grassroots agencies from all over the nation, and we are all reporting that many men are hurting badly. We agree with Thoreau, who said, most men live lives of quiet desperation. We can look at what are the changes in health over the last 50 years, and we see that the improvers are heart disease, infectious diseases, including pneumonia, motor vehicle accidents, smoking in people aged over 30. Other accidents have decreased through good industrial practices. The incidence of back injury, other injuries has considerably decreased through good policy and mechanisation. Cancer survival rates have increased considerably. On the other hand, we find that there are areas that are ones of increasing problems. Obviously, abortion. It's not a very good health outcome for 50% of the people who happen to be male who are aborted. Family breakdown issues, poor relationship formation, lone parenting, underfathering and homelessness are amongst those that are on the increase. The mental health issues of depression and suicide. Remember the United Nations prediction that by the year 2020, depression would be the largest burden of health in the Western world. Substance abuse, drugs, alcohol, hepatitis C, smoking in those aged less than 30. There are sexual integrity issues involving promiscuity, sexually transmitted illness, and sexual abuse. Obesity, especially in childhood, is increasing. Diabetes is increasing. Instead of accidents at work, we now have work-related stress. Cancer is increasing, often because the age group is increasing, and cancer increases with age. Cancer of the colon, prostate, skin, and breast. Wow. The conditions of old age, dementia, dependency, and loneliness. These are you'll see that the physically orientated illnesses are all improving, except those which emerge by age. But the increasing problem areas are largely sociologically determined and are the conditions of quiet desperation. When it comes to social status, the groups most at risk are the unborn, Indigenous people, migrants and refugees, the mentally ill, the socially isolated, including those who are homeless, the disabled, the elderly, and those with a criminal record. In these areas, men are most disadvantaged and bear a particular burden of disease, mental illness and social disaffection. The one dominant factor that stands out is the loneliness of men occasioned by increasing poverty of family formation and family breakdown in Australia.